Hey everybody, welcome back to Stop, Collaborate, and Listen. I am Danielle, co-founder of Coping Creative, and I have Leslie with me, my other co-founder, and I have Dion from the Nurse Dion Show.
Hello.
Hi
Hello.
guys.
What's up?
I'm just gonna go right into addressing the elephant in the room. I know that the people who can't see us don't really have the same effect as the people that can see us, but we just wanted everybody to know that we are no longer in 90s flair today.
Sad day.
I know. It is
Sad.
We're really gonna have to push the energy today because I feel like it's gonna be down. But don't worry, maybe we'll be back with a new theme for a new episode.
We will be back with a new theme.
You will just have to wait and see. So today's episode, we are going to chat about the fact that children are not little adults. And I feel like Leslie and I, and probably even Dion, because he is one of us, he's an honorary child life specialist. We have to tell people that. We have to remind people of that quite a bit. And that sometimes is even parents. We have to remind them of the expectations that we're setting on children often are unrealistic. And we, have to tell people and remind them that, like, hey, look, like, this is a 4-year-old, this is a 7-year-old, this is a 10-year-old, developmentally, and that is very different than an adult. When it comes to the medical field and healthcare setting, we are so focused on the things that we're trying to do and the things that we're trying to get done that sometimes we forget that even people who work specifically in pediatrics are sometimes forgetting that because of that task-oriented mentality that we talk about quite a bit. But
Sure.
I think that we're just going to get right into it, yeah?
Why do you think it is so important to recognize children are not small adults while they're in the healthcare setting? Let's go right to it.
For me, I mean, the biggest thing is that if we want them to be successful, we have to treat them as if they are the age that they are and set realistic expectations. Like, we cannot expect that kids are not going to cry when they are upset or are having big feelings. Crying is a coping mechanism.
Crying is coping.
It is the first. Kids are going to cry and then they are going to play. Number 1 coping mechanism, number 2 coping mechanism. That is generally, what you're going to see when kids are in that, kind of overwhelmed, overstimulated. They're trying to kind of regulate. They're going to cry. And a lot of times you'll hear, and still to this day, stop crying, don't cry. Why are you crying? Like, that is just really kind of bringing so much attention to the fact that people still really do not understand, like, what the developmental needs of kids are, both in and out of the hospital.
And crying is communication, especially for kids, infants, toddlers who have not developed language skills, and they can't express their feelings. Like, crying is communication. It is coping. It's developmentally appropriate for that age group. But, yeah, I definitely think it's kind of viewed a specific way.
So you're saying crying is okay in the hospital setting?
Very much so.
What
Out
would
of the
you?
hospital setting.
Yeah.
Crying is okay, period.
We all need a good cry.
Yeah.
What tips would you give parents then to maybe better word or get that point across of, hey, little Timmy, stop crying. You can do this. Stop crying. What would you tell them, or what's something that they can use to better navigate that situation they may be in?
We do a lot of modeling for sure in
is
those
modeling?
moments.
Straight
Modeling,
facts.
yeah. So if in a heightened situation, if a parent is saying, "Timmy, stop crying," we are there to say, "It's okay to cry. It's okay if he cries, but
Just
he has
need
to hold
do-
still."
correct.
Yeah.
You
So
just need to do X, Y, Z. So whether it be hold still or,
it's okay to cry, but we need you to hold still.
So as a parent, it's literally just saying that too. If we, for example, if we don't have a child life specialist, we meet the parent. Timmy, it's okay to cry, but you still need to still need to hold still. You still need to place your arm out so the nurse or team provider can do whatever they need to do.
Yeah. And sometimes I'll kind of do like a little bit of recovery too. If a kiddo did like really well in a situation from the standpoint of they held still or, they were more, cooperative than some or whatever it may be, but they were crying, I will even kind of go that step further so that parents can hear me in that modeling sense of, you know what? You did great. I didn't tell you you couldn't cry. I told you you needed to hold still, and you nailed that. So thank you so much for, for doing that job for me. And that is just really kind of, I think, that indirect communication of like, I don't their crying is not my focus when we're in the middle of something like that, So I'm not going to focus on that, and I want to reiterate and like validate that, like, this is a lot.
This is
and
scary,
sometimes
yeah.
and sometimes I'll even just do that, and that is modeling for parents too. The kid starts getting upset, and you can feel the room kind of transition, and the parents like. And I will say, even as a child life specialist and a mother, it's just like this reaction of like, okay, what's happening? Like, and it just, you get kind of like overstimulated. So like, I can say that I like sometimes I'm guilty of like trying to like de-escalate like too quickly. And it's just weird when it's your own kid kind of, I don't know, like it's just so different. It's just like a different vibe, I guess. But like, I have to like stop and like take a second, and I'm like, okay, like what are you doing? Like go back to your child life brain for a second, because that parenting, like, oh my gosh, they're freaking out, like, and I need you to not be freaking out, kind of takes over for a split second, and then you kind of like go back to, oh, okay, like you're crying because you're 6, like that's totally
okay.
appropriate.
And as
like,
I think as mothers too, like we want to fix whatever it is that they're feeling. So there is, for us as an objective person, as a child life specialist, like we can take that emotional component out and really provide very direct.
That's like
support.
nailed it.
Yeah.
That's exactly
Yeah.
what I'm trying to say. Like,
Yeah.
that's exactly what it is. I think like it's so hard to be like, not like, I want this to be okay for you. And also kind of like if you're with your people, your team that and your staff that and you're the child life specialist, like, and your kid's the one that's like wiling out, like, okay, like where's the disconnect here, like, but I think that, we really just need to be aware of the fact that, like, and I tell parents this all the time, whether it's within the coping creative side of things or in the hospital setting, because even with coping creative, we do a lot of like caregiver sessions specifically where we're really just working with parenting, and parenting through different things that may be going on. But I tell parents this all the time. And again, I don't think that this is like my words. I feel like I heard this somewhere, but I do use it all the time. I say their age out loud, because it is like such a like firm like reminder.
They
of,
are
like,
too.
Correct.
They
I will
are
go,
too.
You are 4. You are 3. Like, and then I'm like, they're 3. The way that they're acting is like totally appropriate. Makes
For a
sense.
3-year-old,
Like,
yeah.
and I need to check myself and remind myself that what is happening, I need to give grace. I need to, teach. This is either a teachable moment or it's not, but whatever it may be, like reminding myself and saying it out loud makes whatever is happening with, like, whether that be the emotional side or the, lack of coping in that moment or whatever it may be, like, it just is such a firm, like, oh, you're 3. Okay. I'm the adult. You're 3. Like, let's just walk it back for a second. And, like, that has also, I tell parents this story too, that has also kind of backfired on me a little bit, because now my 6-year-old will go, I'm only 6. And I'm like, I know. And then but even when she says it, it is a reminder to me that it is my job to de-escalate that chaos, whatever is happening. And it is my job to give grace and understand what is happening for her, and that she doesn't understand what's happening. And I need to teach that. I need to give her the words and the tools.
Yeah, I think, just as much as we prepare patients, we prepare the parents too. So a lot of times I'll tell parents, she might cry and that's normal and that's okay. And I think just that little statement is like validating of, okay, they can kind of rest, because a lot of parents too sometimes think if they're crying, like that is bad behavior or like, so I think giving them that reassurance of, this might be uncomfortable and they might cry and that's okay. I just want you to stand at the bedside, hold their hand, give them that role and job. So preparing the parents too can make a really big difference.
I think that's where the key of being transparent of what's going on.
No pun intended. Transparent. Is that a pun? That's just a play on
kind
words.
of,
That's a
yeah.
play on words.
Yeah,
Yeah.
but or the transparency of like what's going on with the child, telling them, like you said, like you mentioned, is this gonna happen? Yes, and it's okay to cry. Okay to express those feelings. If you want to sing, if you want to yell, all that's fine. But we still need to do the job. And I love how you mentioned like bringing the parents in to show them the modeling aspect, to show them, hey, they're only 6. This is how we normally talk to them. We'll probably get a better outcome saying it this way, so the child can see that it's okay to feel those things.
And that can be hard sometimes because
Yeah.
we interface with a lot of different parenting styles. So those authoritative like parenting styles of, not showing emotion, don't cry, like it is hard for me sometimes to validate and model because it's like this fine line,
Yeah, because you're not going to, especially like if parents aren't asking for our help, like from the coaching
Sure.
creative side, if they're not coming to us and saying, hey, like we need suggestions, we need recommendations, we need help, and we're just at the bedside, right? That's a very different setting of they're not necessarily asking us for our help, and a lot of times it is like indirect education of like the parents and the caregivers, like to say, they may not like this or whatever, but sometimes once you kind of feel them out, you kind of know like, ooh, like I'm going to have to kind of use a little bit of finesse in order to get like buy-in from the parents sometimes
just
because
whisper in their ear, it's okay to cry.
but yeah, I think that there is, and that I think comes with years of experience.
Sure.
And kind of just knowing like where that line is. Also becoming parents, I think that kind of changes how you look at other parents, because we all said, oh, my kid will never do that. And guarantee they've all done that.
Yeah.
So yeah, I think there is just like a finesse to it. And sometimes it's one of those things that you do kind of got to let some of it go
Yeah.
and focus more on like, what can I do right now? This is not a moment where I'm going to teach this parent how to do something different, like in this moment at the bedside, you know? And then you just kind of give your own words of validation. You did such a great job. You should be so proud of yourself. I'm so proud of you. Great job holding, still, or, thank you for doing your best. That's a great one, is all we can ask of kids is to do their best. And sometimes their best is not what adults would be considered good enough. So reminding ourselves too, and saying that verbiage out loud, which I try to use at home as well, is just do your best. That's all I can ask of you, is to do your best. And then sometimes your best falls short, and that's okay too. And we, validate that as well. Like I did my best, or, you didn't, but what
Or
came
that was
out
the
of it?
best I had in this situation.
Correct.
Yeah.
Sometimes it's only 80%. I've heard people say that through the years, Sometimes as adults, 80% is our best for that day, or 60% is our best for that day. But it doesn't matter because it was our best. It's not best is 100%,
I love that.
I mean, I think
Not mine again. I
it just happened. It just came out.
Still.
I think oftentimes too, what ends up happening, and kids have this fear as soon as they come through the doors a lot of times. So as adults, we can often be very to the point with them, be like, hey, this is what's going on at XYZ. With kids, we learn that we need to more tiptoe to get to the end of what we're trying to get done with the procedure. So how
Call
do
that
you
meeting them where they're at.
meeting them? Well, that's yeah. How do you address a child's fear of the unknown or fear associated with the medical procedures?
That's such a complex question, and it varies for every age, developmental level, their experiences. There's so many variables that kids come to us with. So
Peer
I
dynamics.
I think first and foremost, it's really building that rapport and that trust with them. So that might be getting on their level and, just engaging with them, or blowing bubbles, or that's just giving them space to acclimate to the environment. Like, it can look very, very different. And I think that that's where our clinical skill set comes into play. That is different than, nursing or physicians, to where we can really develop a individualized like coping plan for this kid to make sure that they're successful. It's a successful visit.
One of like the biggest, easiest ways to do that, from whether that be the medical perspective and like for the medical professionals or even the caregivers, is slow down. Just slow down. Like, we are so, and it's
Adapt.
busy. Like, we are busy, yes, but like, just slow down, because the slowing down is going to give that child a chance to acclimate. That's going to give that child a chance to understand and process what is happening, because they're going a million miles a minute at that moment, and their brain is not capable of like breaking that down and like going, okay, like they're literally in fight or flight. Like they do not recognize that this is a safe place to be because of XYZ, whether they've seen things on TV or they've heard things or they've been at a doctor's office where they got,
or they've seen their parents that are scared.
Correct. Yes. Or their parents are stressed, and we all know that's going to feed right into those littles. So, my biggest thing is just like, just slow down. Like, let's just take a moment, a breath, and then assess what this kid needs.
And
they're all different.
That reaction is like an indicator of that, like slowing down. Like, you need, okay, like, why is this patient so fearful or heightened, like immediately, and that's where our brain goes into, have they had a negative experience, and going down that line. But I think that's always an indicator for anybody that we need to kind of approach this patient with delicacy and very much assess what it is that they're going to need.
Going back to the top of like even this topic of this conversation today, it's kids are different than adults, simply as saying like how they process things, how they actually vocalize, or how they don't vocalize their needs. Whereas adults, we're pretty quick on saying how we feel about something. Or you're not doing that today. Like, all right, great, we can have this conversation like adults. But with kids, you can't
Sometimes
have that
they don't
direct
even have the words.
Correct, because they don't know how
have
to.
The words,
yeah.
correct. So something else that I do talk a lot about in our sometimes parent sessions is that right there, is that we are saying, what do you need? What is it? Tell me. Use your words. Use your words. We hear that all the time. There is so many of those children that are like,
my words are limited.
Yeah, like even if they have vocabulary, their brain doesn't know how to give that communication. It doesn't know how to like actually say what it needs to say, whether it's because they don't have the words or they just can't do it. Like, and with my 3-year-old, and I tell parents this all the time too, like, I will say, to be fair, I will say, like, why are you crying? But I'm not saying that like in a judgmental way. I'm like asking, like, genuinely to find out more information. Yeah. And she'll say, I don't know.
Okay.
And I am like, okay. And I'll just say,
it's a starting
point.
point.
Yeah. And I'm like, that's okay. Sometimes I cry and I don't know why. Like, and I just try to go back and validate that for them, because she's literally, I have given her those words though, right? Like, but there are a lot of children that don't know how to say, I don't know. Like, my body is just feeling a certain type of way, or my brain is feeling a certain type of way. So, because I am her mother, she knows that she can say, I don't know, and I will go from there and try to figure out what's happening. But when we're at the bedside, or, when their parents are bringing their kids into a doctor's office and they're just at a 10, there's a lot of times when they don't know. They just don't know.
Yeah, I think obviously the biggest difference that we know is their brain development. As adults, we have fully developed brains. When we meet children, they're at some stage of their brain developing. So it's really understanding that development and what they're capable of and what they aren't, and tailoring our care to meet our language, our approach to meet where they're at developmentally. And that is like truly the foundation of child life and supporting kids and knowing how to do that.
Boom. I was just getting ready to say, I think a lot of times parents don't know the how to do certain things, so they just rely on what they were taught or what their parents told them. I mean, what our parents even told us, especially when involving healthcare related topics. So the question I think a lot of parents would have too, and that I've heard is, well, how do I better say this to my kid to help them understand what's going on? Like, they just don't have those tools and the understanding, the knowledge to do that. So
I think kind of going back to like what Leslie said from the developmental perspective is like, you have to look at how old they are, right? Like you have to look at where their brain is at developmentally, because littler kids need, so, you know, that younger age group is going to need less information. They need less time to process information because of where their developmental stage is at. You know, we give them too much information, we give them too much time to think about it, their brain starts going, and then they're in like this magical fantasy thinking. So then now they've developed misconceptions and they have all of these things happening. So those littler kids need less time, less information.
They also have short attention spans. So very simple, concise language too, to be able to engage them and really convey what we need to in a way that's appropriate for them.
And they're also very literal. So keeping that in mind, if you say something, they're going to take that very literal. So like, for example, we say cat scan, right? And they're going, oh my, I don't like cats. Like, I don't think I want to go over there. Or I love cats. I'm very excited, you know? So I just try to keep that term out of it. And I will just say CT scan or picture, depending on how old the kiddo is. But, you know, terms like that, you have to, and it's okay. I tell parents this too, like, it's okay to say something and then walk yourself back when you hear it and you're like, ooh, don't love that term. That, oh, you know what? Actually, there's no cats over there, you know, and you kind of just want to give them that information right then and there and fix it a little bit. But then when you get to like a little bit older kids, like the school age kids, they want information. They're in school, they are learning constantly, and they're
learning like abstract thinking and logical thought processes are developing. So they're more capable, and eager to learn.
And they are more fearful of that, like, if you don't tell me something suspicious is happening here, because they've experienced that probably when they were younger of like, well, you didn't tell me we were going to do this, and then this happened. So like, if you're not telling me now, like, I don't trust anything, you know? So they do better with more information.
And with that comes detriment too, because when they have a larger capacity to understand, like, then there's more fears that develop and that we see being expressed. So, yeah.
It's funny because that's not actually what I was thinking when you said that. I was thinking, then they start asking like way more in-depth questions, and you're like, all right, let's walk back the process of like how the camera works in imaging or whatever it may be, you know, or now we got to find that out together, because that's also an appropriate response is like, I don't know the answer to that question, but let's find out. We got Google. We can find anything out nowadays, you know? But sometimes you don't have the time in those situations, especially if it is medically necessary for things to happen. You're like, well, the short answer is we need to take this picture, and the camera's going to take your picture. Like, your mom has a phone on her camera, you know, or your mom has a camera on her phone. So it's just funny that you were thinking about it differently than I was thinking about it. But
why do you think it's so important to actually have children be a part of their care while they're in the hospital?
Control creates, the way that I always phrase it is choice creates control, control creates cooperation. So when they are feeling out of control, their answer is no. Like, I don't want to do this. I'm not going to do this. Like, they go into that fight or flight. They're fearful. There are a lot of things that come up, big emotions, big feelings. They're feeling out of control. When we create control for them, which is very easy to do, and I think this is one of those things of like, it seems like we're making up this like huge, crazy like idea, but it's so simple because you can literally create choice out of anything. Do you want to sit over here? Do you want to sit over there? Do you want to sit with mom? You want to sit with dad? Do you want me to look at this arm? Do you want me to look at this arm? Do you want the blue crayon or you want the red crayon? Like, you could
do it all day.
Literally, you could create a choice out of anything. You know, we're not going to create choices on, do you want to do this or do you not want to do this? Do you want to take your medicine? Do you not want to take, like, those aren't choices.
We have to take your medicine,
have to do this.
But do you want it in a medicine cup or a syringe?
Like, so.
For nurses, for example, we have to do the IV. Would you like it in this hand, this hand, this arm, or this arm? And then, like,
do you want to use the cold spray?
Do you want to do?
For those of you that don't know, that is just a pain management option that we have in the hospital. But like, do you want to use the cold spray?
Do you want to use
the
do
cold
you want to
spray?
use Buzz-Bee? Do you not want to
Yeah.
use Buzz-Bee? Like,
Yeah.
it's lovely.
So many choices
so
available.
that choice creates control, and then they feel like they are a part of what is happening, and they feel like they have the opportunity to say yes or no, or this or that, or whatever it may be, and that ultimately comes from them. And sometimes it's even like a choice where I don't know if I can verbalize this the right way, but so sometimes it's like a choice where perhaps one choice is a little bit more painful. Like,
Sure.
so for example, if we're doing a stitch on a kid and the kid is uncomfortable, right? Like they're not freaking out, like they're not having, like, they're not pulling from us, but they're uncomfortable. And what I always tell kids and what my healthcare team generally supports is, if at any time you feel like you want us to stop, just tell us and we will stop and we will take that break and we will talk about it, okay? But then we have to kind of understand the difference between like uncomfortable because there's a bruise and it's uncomfortable versus pain, which is like you're feeling the stitch and you're not numbed up. So, we use a topical at our facility first, and that is not painful. It generally just goes on with a cotton ball and some tape. But some kids will start feeling uncomfortable, and then they'll say, stop, I need a break, and so we'll stop, and then we'll give them the option. Do you want to keep going? Like, is this going to be okay? Or do you want to do more medicine? But the more medicine part is not going to be the same medicine that we used before. This is going to involve a little bit of a poke, and it's going to be a little bit of like a warm kind of hot sensation. And some kids will choose, like, this is too much. I don't want to do this the way that it is, and they will choose to do the more painful option. Usually I'm like, don't choose that one, don't choose that one. But once they choose it, they have now created that control for them. And so, they seem to tolerate it better because it was their decision, but also, like, they really can't blame us.
Yeah,
I don't know how to say that without making it sound like weird like that. But they can't say like, you did this to me, like you made
It's
me
not
do
as
this.
traumatic.
Correct.
Yeah.
That's 'cause it's like
It minimizes the trauma, like that, especially that fight or flight response
Right.
too. When you don't have that control and people are just doing things, there is that fight or flight. So,
and I think it just brings like a different level of like respect to the patient and the child, where we're talking a lot about how like kids are not little adults, but like they're also very capable of doing hard things, like when we give them the resources and the tools.
Absolutely.
So it's like you can set like some expectations for them, but you have to do the work first by giving them those resources and giving them those tools and that validation and that respect and that trust and that rapport, and all those things just have to come first, and then we can kind of go into a little bit more of like, okay, so now we have to do these things or whatever.
I used a scenario when I'm educating like the medical team of, imagine if you were in a foreign country and you didn't speak the language and you had to seek medical care. You went into an ER and you were held down. The entire medical team was speaking whatever language that was. You couldn't understand anybody. Like, how would that make you feel? How would you respond to that? And so I always like to give that example just for perspective of like, this is, you would want to know what was happening, you would. So a lot of times, kids, depending on the developmental stage that they're in, our language does sound foreign to them. So we need to adapt and we need to, use the language that they can understand and treat them in the way that is going to minimize that trauma. So
I was just going to say, I feel like there was a hospital, or I saw some other facility that actually did that with one of their like upper leadership members. They brought them in on a stretcher, and they had all team members that were speaking, I want to say Spanish, but I don't remember specifically. And like the person on the stretcher like had no idea what they were doing, what was going to happen. Like nobody told them anything about it. And it really, I feel like I heard that like years ago, but I think they like videotaped it, and then they ended up like kind of showing like how stressed the person on the like stretcher was. So,
I love
like,
a social experiment.
Yeah.
No,
It's true though.
I love how including the kids into their care and bringing them in and having those more difficult conversations really does help reduce the trauma. Oftentimes, parents especially, we get so caught up, or I'm saying we as a parent, but I'm just saying in general, we already know the trauma that's going to be associated with coming to the hospital, to the point even that we may even tell the kids, we're not going to the hospital, we're not going to the doctor's office, we're going to the park, or we're
do
going
that,
to,
people.
but like, no, that to that end, like what
It is
would
so
you,
much worse. Don't do that. Sorry.
what would you tell parents to help them navigate that situation better? Simply because when they do get to the hospital, they come to those doors, they realize where they're at, they're already going to start tearing up. And as providers, we don't want that to start off there before we even get a chance to say hi to them. So what is something better a parent possibly could do to help navigate going to the hospital or doctor's office?
I think checking your own fears, because a lot of that does come from fear of they don't know how to help their child.
Yeah.
And so they're kind of avoiding, upsetting them, or, so definitely tuning into yourself and how you're feeling and just getting that support, whether that's consulting Coping Creative or asking if there's a child life specialist available at the facility that you're going to be at. I definitely think as adults, we underestimate kids and their capabilities. And like Danielle was saying, like, they are so capable. It's just giving them the tools and resources in a way that they can understand that is important, because they can cope. It's just a lot of parents don't know how to do that.
What is a better way a parent could, though?
I think that giving them explanations of like why certain things are happening helps a lot. So
Them being the
also
children.
Correct.
Okay.
Yes. So parents, giving your kids
There you go.
information, but simple, concrete, appropriate for their, development.
Use books.
Books
Books
are
are
a great way.
incredible.
Yes, books are a great way to make it relatable, to kind of like
Indirectly too, where it's not, this is happening to
threatening.
you,
Correct.
where it's
Yes.
an easier segue to, hey, remember when Johnny was going to the hospital to have surgery?
Right.
We're going to go to the hospital. And it's a good segue. Books are
Yes.
incredibly powerful.
Yeah. And I really like advocate for like start when they're little, if possible. Like start building that trust of like simple explanations. Like we have to go to the doctor because we have to make sure that you are healthy. We have to go to the doctor because you are sick. We have whatever the reason may be. It's, giving them that very simple information. Like my job as a parent is to take care of you and make sure that you are okay. So this is why we are doing this, because I think when you start building that trust when they're little, they know, okay, like, and sometimes my kids, will be like, well, am I going to have to get, even though I say poke, they still refer
shot,
to them as
yeah.
shots, but we try to say, when we're talking about the language and using like a little bit softer language, but so they'll say, do I have to get a shot? And sometimes I don't. I usually will try to find out ahead of time, like what's going to happen, because that will, A, make my anxiety a little bit less, because it's not a surprise when we get there, and B, because I can prepare them. So I can say, and sometimes if I don't know, I'll say, you know what, I don't know exactly, but we'll find out when we get there. And so, giving them, for my little bit older kiddo, giving her like a day to kind of like process and ask questions. And then that also sets us up for like, what are we going to do? What is the process going to be like? What is our strategies going to be like when we get there? And I can bring her in and make her a part of that. So yes, baby, you are going to have a shot. I think it's just going to be one. What do we want to do during that time that's going to make it easier for you? Do you want to take deep breaths? Do you want to do bubbles? Do you want to look at a book? Do you want to close your eyes? What are the options I can give her? And she can be a part of that plan. She can be choosing and making those choices ahead of time. For those little younger ones, I may give that information in the car. Like, we're not going to let them sleep on it for 2-3 days, where, again, we go back to that magical fantasy thinking, and now they've built all these misconceptions. But, hey, today we're not going to go to school. Today we do have a doctor's appointment, so we're going to go see Dr. So-and-so and see, what happens when we get there. And if I know my kid is already anxious, like if I have an anxious kid, then I may kind of wait even closer to when we get to that actual what's happening is a shot thing.
Yeah.
until we're there. Like, I'm not lying. I'm not saying, I'm just going to probably say, I don't know. We'll find out when we get there. I don't know.
It minimizes the time of distress or
Sure.
anxiety,
Sure.
you know,
So
to a shorter period.
Yeah, because I'm trying not to bring more stress and anxiety. So you have to kind of judge your own child, and if you
know
have
them
an
best.
anxious kid, right? Yeah, and if you have an anxious kid, like, then you're not going to lie to them. You're not going to leave out information. You're just going to do it differently. You're just going to provide it differently and in a different timeline. But once you get to that point where you're like, okay, this is happening now, yes, baby, we do have to have one little poke. It's going to be super quick. We're going to count to 3. Like, nurse is ready. Like, we're doing it. It's done. Okay, it's done. It's over. And that's it. So, again, it's kind of like limiting that amount of like trauma and anxiety.
I think that's one of my favorite things as a nurse, seeing when a child and their parent comes in, and I've seen this happen at like as early as 4 years old, where they know exactly what they need because they know they're here for something. There may be a poke, and you'll even say the 4-year-old, "I'm here for a poke," but they like, "I like Buzzy Bee, I like Freezy Spray," and like they'll tell you exactly what they want. So I get the biggest grin on my face when they come in
And they
telling me what they
know, yeah.
want
They're set up
at
for
such a
success.
young
Yes.
age, and they set up for success. So like when parents, and it's funny because I hear literally parents be like, "Oh no, little Timmy will tell you what Timmy, what do you want today for your poke?"
And I commend parents for that. Like,
Yeah.
thank you for telling them
Yes.
why they're here today.
Yeah.
Like, you're setting them up for success. Like,
And every parent can learn from that, though. Like it's one of those things that you have to experience, you have to witness, you have to see through. That's why when I put the consults in for Childlife, especially, I tell the parents like, "Hey, so and so is coming from Childlife. Watch what they do. Like it'll help you navigate." The conversations that you're going to have with them moving forward, and maybe set you up for success moving forward too.
I will say too, like, it's not a perfect process. So like, especially when you're trying that, maybe you haven't done that, and like, no, truly no judgment. We only know what we know. Like, that is really what it is. And we don't want you to feel judged by any means.
Absolutely.
If you have never told your kid that you were going to the doctor, or if you told them, if you told them you were going to Disneyland and you took them to the doctor, that situation might change. But no, you don't know until you know, and you're only doing the best, which is the same that happened with our parents, and it's the only thing that we know. We understand that everybody is trying their best, but if you are trying to do things differently and maybe you are trying to switch up your approach, just know that like it is a learning curve. Like, you may try something and it goes terribly wrong. And you know what? That's fine. The next time, not going to say that word, or not going to do it that way. And you just change your approach and you learn from that past experience and you move forward with the next experience and you move forward with the next experience. And then you're going to eventually have that trust and rapport and that communication that just is more natural and like organic with your kids. That's going to help. And even from like the nursing perspective, like the team that's the same thing. Like, you may do something a certain way one time and you're like, ooh, that did not go well,
guilty.
And so,
I've done it as a child life
absolutely,
specialist.
correct.
Yeah.
You're like, oh, I shouldn't have said that.
I was just getting ready to say it. There's
Yeah.
been countless times where I've been with the patient, have my child life specialist with me, and I do something or say something a certain way, and then I hear them say it.
And they're like correcting
They
you.
correct it, and I go, "Yeah, what she
Yeah.
said. That's
Yeah.
why she's here. That's why."
So this is just a quick side note, but there is a doctor that I work with, and all we were doing was looking in an ear, and they were just trying to get like wax out of it, I think. Like, and I don't want to say all we were doing because that can be painful, and respect to the child and all the things, but
Your feelings are valid.
yeah.
Okay.
But yeah, so the provider was either a PA or an MP, was the one that was kind of like trying to get out this wax or whatever. And the kid was doing fine on the bed, was just laying there, chill, whatever. But the provider was looking to the doc for like extra support or whatever. So the doc comes in, opens the door, and he's like, "All right, Mom, so we're just going to give it one more shot." That kid just went
Said the
right
word.
out the door. I was just like, oh my God. And he, like, we laugh about it now because he's like, he's looking at me like, "I swear I didn't mean," and it was just, and we still talk about it to this day. And he'll kind of like be like, "Oh, you're going to tell him like we're going to give it one more shot?" And I was like, "Well, we're not going to say that."
We
But
had a physician that would go into rooms and thought it was hilarious to even joke about that. Who wants a shot today?
Yeah,
man.
that's
No.
you're traumatizing
No.
kids. Please don't do that.
Yeah, stop it.
But yeah, he felt so bad though. And
That's- yeah.
and then it's just
Honest
like, no,
mistake.
we're not
Yeah,
gonna do that,
yeah.
And it is okay to correct yourself. And you just when you hear it, you just correct it in the moment. Like it's a lot harder to go back after the fact or, whatever. You just try your best to correct it in the moment and change your language and just go, that's not what I meant. That's not what I meant.
Right.
Like,
So always tell your kids what's happening. It's just there's a way to do that.
and be truthful and honest. That's really like if your kid asks you, the best option if you think that telling them the absolute truth is going to cause more stress and anxiety and you have a little bit of time is to go with like, I don't know right now, but they're gonna do better if you just tell them the truth and you give them the opportunity and the resources to cope. So, I tell kids all the time, we don't lie to kids here. I'm never going to lie to you. If something is going to be uncomfortable, I'm going to tell you. If something's going to hurt, I'm going to tell you. If something's going to be, whatever it is, I'm going to tell you. Because I want that kid to be successful and I want them to trust me so that I can give them those resources because they're not going to listen to me if they don't trust me. And also I want to set them up for success in the future, for future experiences with future medical teams and people, so that they're not just walking into a hospital as soon as they get there and having full-blown, emotional overload, essentially, because they didn't trust the last people because the last people lied to them. So, just really trying to be honest and truthful as much as possible. Invaluable.
I love that. Even for providers, we have to do better. We have to, like you said earlier, just check ourselves and make sure what we're saying is as completely honest and transparent as possible so the kid can continue to trust us and help them navigate through that.
And those emotions, like expressing that fear is normal and okay.
Absolutely.
That's why preparation is so important because if we have time before something is going to happen where they can express that safely, it's going to be less intense during the actual procedure or whatever it is that we're trying to do. So we can't take it all away, but we can certainly minimize it with information. So
Well, this was good. I love this.
Well, we hope you did too, guys. We will wrap this episode, I think, and be back, we hope, again soon. Are we going to do our 1, 2, 3 again? Is that going to be our closer?
Can be.
All right, guys.
We're doing something.
We're doing something.
Till next time.
until next time.